We're going to talk about a new way of looking at youth and beauty, which is going to be quite different from probably a lot of things that you have been taught about rejuvenation. Instead of lifting, we're looking at volume as being a cornerstone to rejuvenation. So it's a very different paradigm. And we're going to first of all establish the paradigm so that you can understand the concepts of the beauty. Then we're going to go through the dynamics of how to do it to achieve the results. And then finally, I'm going to go through some of my results. And it's not just going to be a smorgasbord of results, but really I want you to sit there and try to analyze exactly what I've done and why that's beneficial. And there is a level of artistry that's involved that you don't necessarily have to have when you first start this whole procedure out, but you can acquire over time. So we have to first understand what is a youthful face, and that may almost sound silly because unfortunately a lot of times when you go out there you go, well, I know what a young face is, I see one all the time. But if you want to do it from an analytical perspective and try to figure out how you're going to achieve a youthful face, you have to really begin to understand the dynamics of it. Otherwise, you get a lot of people that look very tight, but they don't look very youthful. So it's a concept from the ground up that I had to relearn, even after fellow 2 years now. I wouldn't make them this extreme, but this is still an extreme. And if you understand fundamentally what sucking away fat, elevation, and sculpting does, it's essentially the same thing that aging does, which is taking away volume around the eyes. And I'm going to sort of answer some of those ideas of when a blepharoplasty would have a positive role and when it wouldn't, and how to do it in combination with fat grafting. And the book that I wrote that came out by Lippincott in late '06 is called Complementary Fat Grafting. The idea is how to marry, not to necessarily throw out the baby with the bathwater, but to how to look at lifting procedures as an integral element to volume. This may not be entirely a resonant lecture, maybe more for the practitioner, but I think it will help train you in thinking. So what are we talking about? What are the keys when we look at volume shaping and we look at rejuvenation? We have to look at the full volume and shape of a face. The heart-shaped face of youth, the triangle. You saw in Christy Brinkley the triangle like this. What happens over time is that triangle flips. The jowls get more prominent and everything begins to move toward the lower face. Both, yes, gravity, and also because of volume gain. So I just talked about volume loss, but there is a component of volume loss and volume gain. So what we have to do is look at our friends dermatologists who really don't look at gravity. They look at hypertrophy-atrophy models. And I really sort of marry the idea that we have to look at our colleagues, dermatologists and facial plastic surgeons, to find out what exactly is the right strategies. Also understanding that the face of youth has tremendous highlights. A lot of luminosity. I like that word because it captures exactly what I'm trying to do. Because when I see a youthful face walk through my door that I've created, even 30 feet away, the presence is there. I can see they look great. Before I can see a wrinkle, before I can see the brow position, they look youthful. And really no transition zones. Very few ideas of where one part transitions to another. So that whole idea at the end, framing the eye, is a key, because we have to be able, we have to frame the eye. So it's the opposite of unframing the eye, which is a brow lift and skin removal. So this is a mother-daughter pairing. If you look at the mother, you can see that look at the daughter, she's got the triangle we talked about going in a heart-shaped face. The mother, who's had some weight gain, has also had some volumetric loss in the upper face, and you can actually see the inversion of the triangle. So the attention is pulled away from the eyes down to the lower face. So if you look at that eye, you may say, well, she needs a brow lift. Come on, Sam, this is easy. How about an eyelid surgery? Well, maybe, maybe not. And we're going to go through some of those, probably a little bit more the technical details in a moment. So what do we do here? This is a great metaphor that I like to use. When we're youthful, we are great. Over time, we become a raisin. So the question is, why should we take that raisin, cut, pull, stretch, lift it into a pea? Because a pea does not look like a grape. It looks like a different animal. So the idea is to try to get someone looking back to where they are, and filling is a critical element to that. So the other problem oftentimes is, about 80% of my rejuvenative patients, other than hair restoration, are females. And so females, really, they have a different way of looking at the world than men. And as men, we probably don't own a very magnified lens, but unfortunately the way you put on makeup is very close to a mirror, and then everything looks distorted. Everything looks terrible. It's that one minor little flaw that captivates their imagination, their mind, and they get obsessed with it, even when they pass by a normal mirror. So you have to first understand what problem they're seeing to get into their mind so that you can rectify it. Because the thing that I want to attract you to think about is throw away the 8x, 10x magnifying mirror. Because you may not be able, as a guy, as an XY chromosome, understand what is the woman looking at. And you may try to appeal to that, but the problem ultimately is you satisfy that person. No one else can see that person looks rested or good because they're that close to the mirror. So when you look at my before and after photos, when you look at other people and you're trying to judge beauty, you got to pull it back 5 feet. Look at them with normal overhead lights, not like this where there's scant lighting or uneven lighting, but uniform overhead lights. The way I take my before and after photographs were all done without fill lights because I think they help establish how you and I see each other in a social, professional engagement. Because if you think about it, 99.9% of the time of our life, we live in a world where we have only overhead lights, whether it's outdoors or indoors. So fundamentally, think about the facial shape. It's the whole global aspect of the face that's important. And some small things about it is, if I'm talking about volume, can we just put a malar implant? Can we just go put a chin implant in? I'm going to show you in some instances why that not necessarily is the case to get a good result in terms of volume restoration. And finally, understand the gender differences. If you feel everyone the same, you're going to make everyone look the same. What happens during the aging process is that women become more masculine. Men become more masculine. If you take men back, you can feminize a face. Oftentimes, men look a little bit more rugged as they get older, and you've got to ask the patient, where does that person want to go, based on psychological motivations and also photographs of the past. So using those old photographs can be an incredibly important blueprint of understanding, oh, you wanted this, I thought you wanted that. And so that's my starting point of communication, is using an old photograph. So this may be a challenge for you guys to start asking your patients, if you're going to do rejuvenative procedures, let me see an old photograph, see where you started. So it's a patient re-education, just to reiterate this, is taking the person and bringing them farther away from a mirror that they may be accustomed to seeing. Let's talk about the principles of the technical principles. When you start doing fat grafting really is irreversible. You don't want to go in there and start overfilling patients because it's extremely hard to correct. You want to stay more conservative until you start getting an aesthetic eye of seeing what your results look like over a period of 1 year to 2 years and beyond. So fat also you have to understand how to do it to avoid complications, and also to understand where fat works better than other places, because a lot of times the problem with the past of fat not lasting or fat not working well is also a fundamental error of where to put it. If you put it into lips, into lines, yes, you can help both of those. Without a doubt, you could go up there and show me great photos of correction of facial lines and lips, but the problem also is that there are many better techniques to correct those than fat. Fat, in my opinion, is really looking at to be used as a contour agent to help refill around the periorbital region in the chin and the cheeks. And that's really the essential element. So, the complementary approach, just briefly, is the idea that we don't have to do everything through fat. The whole world doesn't have to be filtered through fat. But in my opinion, it is the cornerstone to rejuvenation. I combine it with selective transconjugal blephs, selective upper eyelid skin removals without muscle removal, and rarely brow lifts today, and facelifts, of course. So this book that I wrote really tries to make it easy. Make it more like a cookbook recipe for someone approaching it for the first time. We have 16 videos in there to help you start with this so it doesn't become this overly taxing artistic endeavor. Starting with the concept of volumetric foundation, we basically allow you to start with, okay, here are the number of cc's you need in this distribution so that the patient can consistently get a safe, conservative, and wonderful result, especially if you're looking to combine it with your traditional rejuvenative techniques like lifting procedures. And then we look at refinements. After you've done it for a few months and start seeing where you're going with it, and you see that I could have done a little bit more, you can always use your aesthetic judgment and add to that. And then really looking at the areas that are more advanced, the places that could potentially cause complications, and avoiding that on the front end. So this is a little drawing I did for the book, and it just shows you what I mean by a volumetric foundation, the areas around the eyes, the cheek, and the jawline, which are the critical areas to fill. Everything else is gravy. This is the area that if you combine this with your eyelid procedures and your facelifts, you get a very, very satisfied patient because they really can see what you've done. Refinements are just adding the little things and nuances, the areas that, as you get a little bit more skilled in your experience level, where you could put a little bit more. And finally, things that may be complicated, the areas that are more, in my opinion, somewhat corrective in the upper eyelid due to overzealous prior blepharoplasty, and also temporal fills. And because, essentially, as we're surgeons, we're very visual people. We look at the face and understand the planes and work through that. Fat grafting is not as visual. There is a feedback as you see the fat go in. You start seeing where you want to start or stop. But a lot of it is tactile. It's using bony landmarks and feeling where you are going more than actually visualizing the planes. So we're going to go through some of those elements in a moment and make it a little bit clearer. But the easiest way when I start talking through this to help you understand the technique is to walk you through 3 levels. Essentially in a supraperiosteal deep plane, at a medium depth somewhere through the muscle fascial layer, and then somewhere deep, somewhere superficial closer to the dermis. Obviously you're not intradermal, but into the deeper to mid superficial subcutaneous layers. Pre-jowl sulcus. If you do a facelift and you're wondering why that jowl is still there when you're done, it's because you didn't fill the pre-jowl. You say, well, I'll put an implant, I'll put a pre-jowl implant. But think about one fundamental thing. That pre-jowl implant that you need to put in is, first of all, you got to go and make a decision, put the implant, alloplastic material, and it sits. Where does a pre-jowl implant sit? It sits on the anterior aspect of the mandible, correct? But where is the jowl? It's hanging over the mandible. So how is a pre-jowl implant sitting in front of the mandible going to efface a jowl that's hanging below it? So yes, a facelift is important. If someone's got a jowl there, I'm not going to promise them a smooth jawline without a facelift. But here's the trick. If most people don't want facelifts, if you look at the last 5 years, there's been a trend down from facelifts. So if I offer them an incisionless technique, it's much more captivating to the person out there. But the trick is, fat needs to be thought of as a 3-dimensional cylinder. Do you see those 2 cannulas there? You put it on the anterior aspect of the mandible, you put it on the inferior aspect of the mandible, and you transition over that. If you do that, you'll get a much better pre-jowl fill than any implant could ever achieve. So the postoperative care is relatively easy. There is no dressing, there are no dressings, no sutures, nothing to do. They just go home with some ice. I don't put any microfoam or anything on them. Just cut down dietary salt, a lot of Valsalva when bending over. That's the main thing. Usually the best way psychologically to prepare someone during the immediate postoperative period is to walk them through psychologically of how they will perceive themselves. The first week, they don't recognize themselves that much. The second week, they're getting there, but they're probably still very critical of themselves. Whereas other people looking at them probably think they don't look that bad. By the time they hit their 3rd week, that's when they begin to accept where they are. But almost every one of my patients only takes about 7 to 10 days off. And that's using other people's photographs during that time, videos, and using their own photos and following them really helps them understand this. Let's talk about the first goal, inverting the triangle. Do you think I did a facelift? Do you think I did liposuction? I did take a little skin from the upper eyelid, but the triangle has fundamentally been inverted for this 46-year-old. And I think I've actually somewhat undercorrected her lower eyelid, but you don't notice it as much because there's a nice balance of the face. The pre-jowl sulcus has been eliminated simply with fat, and this is held now for 14 months. This lady here is about 8 months out. If you look at her, it looks like she needs a brow lift. It looks like she may need a blepharoplasty. It looks like she may need a facelift or a cheek implant. But all of this is done with fat grafting. There has been no cutting at all. And if you see that there's a bony exposure of the upper eyelid, that is a fundamental problem. So what I did was I framed down the eye. What you see is initially is an eye bag. That's not an eye bag. That's an emptiness there. And you can see the triangle has been flipped. In fact, one of the major fears people have with fat grafting is I'm going to look fat. Which looks fatter, the lady before or after? How about the one before I just showed you? Which looks heavier? That's because what makes someone heavy is this. Is that right?
I'm going to bring this down so you can see a little better. It's hard to see.
Oh, okay. Thanks. Thank you. If you look, do you think I took an eye bag out, or that I lifted the brows, or I took skin out, or did a facelift, or I put a chin implant? I didn't do any of those things. This is all done with fat grafting. This is about 9 months out. And I want you to see that there is a nice balance to the face. If you look at this, she's had a facelift on the left, but it's not really done anything. This is fat grafting around the eyes, the lower eyelid, the brow, and the jawline. If you can see, and she's lifting her brows a little bit, but that's positional inconsistency. But I want you to really see what the problem is. It's a fundamental bony attribute to the mid and upper face. And that is what I corrected. You don't need a brow lift here. And an eye bag would be a more assured way to achieve this result, but I've achieved it pretty well. And I always consult my patients that a transconj bleph, when the bag is significant enough, probably should be considered as a corollary to getting a good result there. The lady on the left here has had cheek implants, chin implant, and a facelift, but she still looks tired. She still has a jowl. The example on the right is shown just with fat grafting. I've eliminated the pre-jowl sulcus. I've actually, if you think about why the cheek implant has failed, when you get a bony upper face and you put an implant under there, what does it look like? It looks like bone. So what is the issue then? You know, if someone said, well, let me just eat more food. Well, if you eat more food, you just get a heavy face. I'm actually lightening the face with fat. I'm framing down the eye, and I'm actually, in this case, softening transitions, because the cheek implant exacerbates those transitions, further hollows the suborbital rim. It further hollows the buccal sulcus. What this is doing is blending. It's blending everything. And here's the other trick. What is the most feminizing attribute of the face? This is not going to be on your board exams, unfortunately. It's the anterior cheek. And if you see what the cheek implant was positioned, it was over the lateral zygomatic arch. That's masculinizing. So I want you to understand a different approach toward a feminine face. Framing the eye, the reverse of the brow lift and blepharoplasty. This lady on the left has been fundamentally altered. Her identity is not even the same. She's had everything taken away from her. Brows lifted, her skin removed, everything taken away. And what's amazing is, at least I can start with an old photograph. It's not a perfect result, and as I told you, fat does not eliminate lines. But at least I can slowly bring her identity back to her. And if you look, after 14 months, these are all, by the way, one treatment of fat. This is not 6 times, 8 times you read. If you look at that lower eyelid skin over 14 months, it's actually smoothed. What I will propose to you is my results begin to look excellent 8 months out. And they don't really look excellent until a year to year and a half out. That's a reverse to everything you know about fat grafting. If you look at this lady, looks like she, what are you gonna do to make that eyelid rejuvenated? It's skin shrink wrapped on bone. You're gonna do a brow lift? You're gonna take skin out? What skin? You're gonna take fat out? What fat? And if you think about it, if she didn't have surgery on the left, but that's what surgery does, is it takes the frame out of your eyes. And aging and surgery have done the same thing for her, but she hasn't had surgery. So it's filling. It's filling down the eye, the cheek, and the jawline, and creating, and she did not have a facelift. Would she benefit from a facelift? Fundamentally, yes.